Hello, Tanya. This is Alexi here at Meridian Integrated Health and Wellness Center. Here we have Cecile, who will be my client. What we'll be working on is TMJ. So we can go from wherever, and let's just say that she has it on the left side or she has it on the right side. In this instance, perhaps the right side would be better, just because of the way that the camera is. So, without further ado, this will be a general treatment. We'll go over precautions, perhaps if she were into car accidents. So we should be doing vertebral artery tests. You can do a vertebral artery test maybe perhaps before the treatment. If that's the case, then well, I guess we could start off with a vertebral artery test. So you ask your client if you can just scooch off the table. You support their head. Perfect. Now you have their head. You bring it to the one side and you tip it ever so slightly back. You take a look at their eyes, making sure there's no fluttering or they're not passing out, and then you ask them to count backwards from 10, so 10 to 1. So you want to just count from 10 to 1, Cecile?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And then you do the other side. So if you want to just say hi, Cecile. If you want to just count 10 to 1 for us, Cecile?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Now, if she were to act funny in any way and she were to say things like 8, 9, 2, 4, and possibly any eye flicker and things like that, then you don't want to be putting them in this position. They'd be testing positive for vertebral artery. So then you have them back, scooch forward. So now you don't have to worry about it in the middle of the treatment. You don't have to be like, oh crap, I forgot about it. Alrighty, so without further ado, I'll try not to talk as much during the treatment. I'll just do the treatment rather than blab, which I like to do. So, we're working underneath the zygomatic bone. Zygomatics, I should say. And then you can slowly transition into palms on the temporalis, like so. And then perhaps even both. Little circular frictions underneath the zygomatics, and circular type movements on the temporalis. And you can work your way down into the suboccipitalis. Try not to pull in their hair. And then work on the suboccipitalis. Work your way down, perhaps C7. As you have the C7, your hands meet together, your elbows are on the table, and then you do a bit of a traction. So you're like this. You're bringing, almost like the way that I picture it is you're trying to almost bring the C7 towards you. And then work your way down, or perhaps your way up the C's. So what I mean by that is you're at C7, then you work your way up to C5, C4, C3, and then eventually to the atlas, or the suboccipitalis. I'm sure you could include some ear stuff. Not ear, like not putting your finger in the ear, but just, having the earlobes in between your fingers. And then you can go back to more circular frictions, but this way you're working down the jaw, down the masseter, I should say. As we practiced in class, it didn't seem like we were, I guess the best way to put it is it was directional. So it was directional move. So we weren't going up and then circular. We weren't going circular back up. We were just going down. And then we start back right here. Then we work down, work down. And then you can even drag it down like this. So drag. And you can possibly go back into these type of movements. Some circular frictions on the actual TMJ joint, or on the TMJ. Maybe some more pulling. How much time we're at? 6 minutes. Okay. And then down. Some more circular frictions. And then down. Some circular frictions directionally going down. And then drag it down. And then back with even 2 fingers, and then maybe pinch the ears a little bit just to, I don't know, probably feels nice. And then from here, so we said with all these circular frictions, at this point we could have assessed any abnormalities. If one side, you can always, people tend to have a dominant side that they like to chew on. So I always like to eat it on my right side. Perhaps, let's say Cecile does as well. And that side was much more developed. And if I ever had any TMJ type symptoms, it would have been always on the right side. So over time, I guess trained myself to eat more on the left side. So now naturally I notice that I eat more on my left side, but it took a long time to get there. So then, let's say it is on the right side. It's more dominant. Perhaps there's even, just feels abnormal, maybe even some clicking. We can now, having our hands on both the TMJs, this is the one that we're going to work on right now. So, circular frictions. Really get it in there. Perhaps even more dragging. More circular friction. Look, assess, find if there's anything weird about it. Like, it's almost as if there's little ligaments that can pop back and forth there that are perhaps taut. Almost the same ones that you would feel on a knee joint. People have knee problems. They'll have like a medial collateral ligament that just, you can strum it like a guitar string. And then I'll show you what I did on the other side. It's because you wanted to work both sides anyhow. Thumb is right here on the TMJ. And then we flip over on this side. Like this. And you can do even little circles of the head, pushing down with the left hand, and then when it's going up, you're pushing with the right hand on the TMJ. So Left side, you're circular frictioning it. So you're doing a circular friction while you're pulling down on the left side, and then when you bring the head up, you're pressing with your thumb on the right TMJ. And you can do little circles like this. You can do on both sides. I think I remember doing this in class. If not, I apologize. And you can bring it back. And we'll go back to our favorite. That might have been a little bit. Oh, I think it's okay. And we'll go back to our favorite. Just this. Circular frictions around the zygomatics in the TMJ area. And then maybe some more pulling. And then you can always just reassess. See if you feel anything that's different. Now, since we warmed up this area pretty well, we will press on the TMJ, almost like hook it up if you want, but pin it, compress it, and then have them slowly open their jaw. And then in this case, you know what? Even better, you assess before even pressing on there. You ask them to open their jaw slowly, and then slowly close it. Now I do have my fingers on there, so I feel for any pops or clicks. And then I'm looking for any S or C bone, like if there's any blows or any movements of one side to another. Now, so here you go again, Cecile. Open your. Do it one more time. See, just like Chris, when she opens it, it pops, and then when it pops, it slightly goes to the right side. So I haven't seen in these two cases yet like a slow transitional S or C. It's more of it's going, then it pops, and it goes one way. Perhaps I think mine did that too. I'm not sure. So hers went to the right. So then you go back into this nice Julie, and then you have, once you press on the TMJ, you have them do the same thing, slowly open their mouth, and you compress and resist it almost. Do that again. Again. Look for maybe better spots in the TMJ, or on the TMJ. Nice, perhaps. There you go. And then you can reassess. Do that one more time. But most likely, well, I could help. This is techniques like this, I believe, are the most effective. Like the one for me that worked very well was when Chris had her fingers in my mouth and she was doing it with my pterygoids. I was shocked. It worked very well, and with the mat as well. So you might actually see a difference already in this technique alone. I think the Julie is good too, for it warms it up and it gets you ready to doing these more aggressive techniques, because this is perhaps similar to what a trigger point therapy would be, because it is similar to a pin and stretch for your pinning structures, muscles and ligaments, and then you're stretching them by having the person open their mouth. So you reassess again. So we'll open your mouth there, slowly, and then slowly close it. And open it one more time. Perhaps it got better. I mean, maybe I'm just telling that to myself, but looks like it got better already. I don't see the clicking as much. There you go. So you go back to your Julie. If it's still doing it, you can do it again. Maybe one more time. Don't overdo it though. Oops. And then remember how we did the vertebral artery test. This is why it comes in handy, because at this point we ask them to earthworm or worm their way off the table again. So Cecilia, if you want to just scooch up again and make sure you're supporting their head through it all. There you go. Now this is an interesting one. So you find their hyaloids, or almost basically aneuploids, and they lie right behind your mandible. Your mandible, I believe. Yes. And you almost like hook it like this. And it's an uncomfortable feeling. And you want to lift up their head a little bit because you just want to shorten them before you stretch them. So it's like this. You have it hooked, and then you stretch it. You should feel a little bit uncomfortable. Start a couple times on that side, and then work your way down. And we can do that again. Start the hyaloid, and then in one direction, just work your way down to the clavicle. Now, once we get to the clavicle, same thing. You could do it standing, maybe. No, because then you're doing your wrist. You transition to a palm. And try to keep your fingers nice and high so you're not touching any breasts. And perhaps if this was a lady who has like breasts up to the ceiling, maybe try to go like this, or even like this. Just, well, if that was the case. Same thing, it's almost like a fascial stretch. You have the intention of pulling the skin down like this. And then once you bring the head down, it will stretch the fascia. To me, this looks like a fascial stretch. I don't see it as anything else. Because you have the intention of having the tissue one way, and then when you're moving the head, you're stretching the fascia. And then make sure, so support her head, don't drop it. Make sure it's safe, and then you can leave the one hand. And then make sure you do it on the other side. So same thing, you hook underneath the mandible, and then you stretch the hyaloids. How's it feeling there, Cecile? Not too much pain? Doesn't feel like I'm pressing on any arteries, any lymph nodes. Try not to press on the trachea. And then work your way down. Oh, we're at 18 minutes already. Oh, I guess you said 25. You said 25 minutes.
Nothing.
What's that?
There's no time.
Oh, okay. Awesome. Want to just move your, yeah. So once you worked your way down to the clavicle, after one directional flow with these pin type stretch movements, same thing. Palm up, head up. See, maybe you want to readjust a little bit.
What do you mean?
Oh, just relax. Just relax. I need to readjust a little bit.
Okay.
And then she's a little more restricted going this way. Perhaps there's something with her SCM or cervical muscles. And then same thing. Set the intention. Head up, down. Or perhaps head up, set the intention. Then head down. Head up, set the intention, down. Now you can ask your client to scooch back down, supporting their head. And you can do the same thing perhaps, just this way. So now, you have your head this way, it's already tilted to the left hand side. And then with your right hand, you set the intention. And then you further tilt their head to the left side. Same type of thing where we have the intention set, and then with the movement of the head, we're stretching the fascia of the pecs. And maybe you could do the same thing this way. So perhaps this could work very well for a person who did test positive for a vertebral artery test. You do the hyaloid here, and then you move. I don't remember doing this, but you did do this one, so I assume if they did test positive for vertebral artery test, you could do this instead. Yeah, so underneath the mandible and the hyaloids, and I'm moving the head to one way, and then you work your way down. So I'm moving the head back to neutral a little bit, and then bringing it out to the side. Head neutral a little bit, out to the side. Once we get to the clavicle, we'll change it to a paw. A palm, I should say, but lapa. And then we move to the other side. Same thing though. Do it nice and quick. So I don't know if you can see me here. See, I'm moving the head back to the middle, and then down this way. To the middle, and then down this way. Towards you guys. Alright guys. And then once you get to the clavicle here, lapa. Set your intention. Once you have the head tilted all the way to the right, ease off with the tension a little bit, and then just keep doing it. Make sure you're not touching any breasts. And there you go. And then from there, I'm sure you can just maybe just a little bit more Julie, like right here. Perhaps you can get in there a little bit more if you wish to work in the suboccipitalis area. You could press on the suboccipitalis, ask him to swallow. You can feel where they're swallowing. And if you can feel them swallowing, then you know you're on the right spot. Maybe work there just a little bit more. Yada yada yada. Ask them to swallow again. So it takes Cecile about 7 to 8 seconds to swallow. I don't know why. So then that. Maybe go here a little bit if the traps are a little bit tight. Maybe give it a bit of a stretch. Yada 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 yada. This way, that way. Schmaznazzle, bamboozle, timtazzle. I don't know what I'm saying. And then just go like this. These are the last moves that you'll do with these pair of gloves before you depart with them. So make it count, because they're gonna be in a dirty mouth after this, and you won't be able to do this anymore. Well, unless you just change your gloves again. And not that her mouth is dirty, but all mouths are dirty. I should stop talking. So, take your gloves off. Make sure you already had a set of gloves set up for you. When you grab your gloves, try to grab them like this. This is where I messed up on. Don't go and grab the fingers right away, because, well, those fingers are going in the mouth. Just try not to touch at all the outside of the glove in any case. Try to go right for the hole. And then from there, you can, I guess, squeeze your way this way. So the rule of thumb is to not touch the outside as much as you can. And if you do, just chuck the glove away. Let's put this down here. And then now, 2 pairs of gloves. And then just to make sure they're on, you gotta rub them against the walls. No, don't do that. So, the way I'm trying to practice it, or think of it, it's like those surgeons, or perhaps nurses or doctors in Grey's Anatomy. They always have their hands up like this, no matter what. So it's just that same idea. And then when you come up over here, elbows are an exception. You can have it like this. So right away, so let's say if we're working on her left side first, perhaps I don't know which one you'd want to do first. Perhaps you'd want to do, I think you did say you want to do the effective side first, but let's just do this side first. We have our left hand on the bicipital groove. I remember you saying that, so like, yeah, well, the bicipital groove in the and just like, you can rest it almost on the clavicle bicipital groove area. And then, so if the way I look at it, if the left forehand is on the left side, then you'll be working on the left TMJ, but the head will be tilted to the right. So left hand is here, that means we're working on the left TMJ. Want to open your mouth there, Cecile? and then you close your mouth there. So then we're like this, and then head's tilted this way. So left hand, left TMJ. Easy to remember. So now you can, we'll do this one really quick because I don't know if you can really see me that well from here. We'll strip, we'll circular friction to TMJ, we'll work into the pterygoid, we'll work in there, we'll ask them to open their mouth while we're compressing the pterygoid, we're feeling for any clicks or things of that nature, and then we get them to close. And then let's say we worked on there for a good chunk of time, but you guys want to see the other side to see what I'm doing, right? So there's some PRs that we could do in between, but I think PR would be better, in my opinion. Maybe I'm wrong, to do after we do both sides, because then you run the risk of getting slobber on their chin. Because you're, well, I mean, you could try, I mean, you could go like this or maybe like this. So maybe that's something we'll discuss after the video. So now I'm working the right side. So right hand's here. That means we're working the right, so open your mouth there. So they're working on the right TMJ, close your mouth, and then we bring it over to the left side. So now you can see what I'm doing now. So now you wanna, there you go. So now you're almost a little on the left side of the table a little bit. You're stripping up like this. You're stripping. Now we're working a little bit more on the outside at this point right now. So we're working the TM, like the actual, like the, how should I say it? More of the masseter as well, is what I should say. And working on the outside a little bit. You're almost like beaking it. You're like grasping it up with your thumb and your fingers. Then you do a little bit of circular frictions like this. And then you feel for the pterygoid. It's like right by the molars there. It feels a little bit weird. And then you press on it, and then you ask them to open their mouth. Pain's okay? Okay. And then close. Okay, she just touched my glove here. So I know, but you, yeah. No, it's okay. It's not your fault. And then open your mouth one more time. And then close it. And then like that. After that, you could maybe do a little bit more of the frictions and stuff like that. Let me just change my glove real quick here. Perhaps let me just change both gloves just to be safe. So, you worked on both sides, right? Okay. Now you can do some, maybe a little more Julie. Well, I can do Julie right now because I changed my gloves. But you actually wouldn't be able to do Julie because you'd have slobber on them. But let's say that your client did touch your finger and you have to change your gloves. You can get away with doing Julie, yada 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 yada. And then you do a little bit of PIR. So we can start off with, we have to find an end feel. So open your mouth there, and then resist me 10% by opening it. Yeah. Well, I guess you want to do the breaths. You count to 10 seconds. You don't force closing their mouth because you can dislocate their jaw or hurt it. And then relax. And then you see if there's any. No, sorry. Should I do that again, Cecile? Do the count to 10 seconds, and then you ease off the pressure and see if there's a new range of motion. No, don't relax. Okay, I'll do it again. So she's opening her mouth, and now she's resisting me at the end feel, and we're counting to 10. And after 10 seconds, you stop resisting and see if there's a new end feel. Now let's do this vice versa. You can, I guess. Open your mouth, Cecile. Now try to close it with 10%. Take a nice deep breath in. And relax. And that's that. So I had an exception because I did change my gloves for the third time, so my gloves were dry. But you'd want to be, not that it's dangerous to get their own spit on the outside of their face. It's just not nice. They might not see you again. So that's it. That's all. That's that. That was my treatment. Thank you for watching, and well, that's that. How am I gonna turn this laptop off now?
Push the red button.
Yeah, but oh, where's your napkin? Oh, I bought this napkin. Have a good one, Tanya. Thank you.